compounding personal training. So these medications need to be handled a certain way. So for any staff in the compounding pharmacy, they will need training. So the training consists of didactics and hands-on training. So you're going to do it initially, and then you're going to be trained thereafter. Any updates, you'll be need new training. They come out, once a year, so typically the training stays the same. So required training and testing, you're going to need to be tested on hand hygiene, garbing and gloving techniques. And for this, you're usually gloved, and your fingertips are tested using tryptic soy agar. Passing required 3 consecutive gloved fingertip samples with 0 CFUs. This is required initially, then annually for low to medium risk. You'll be tested and trained on sterile drug preparation and cleaning and disinfecting procedures. You'll be required to take a media fill test, which is used to determine if a compounder is preparing specialty products in an aseptic manner. This test contains that tryptic soy broth, where you'll be tested to see in 14 days if any cloudiness will appear. If not, then you passed. If there is any cloudiness, then that means it is contained. So you'll have to retake the exam as well and wait another 14 days. The SEC must be monitored at least once daily, should be kept at 20 degrees Celsius or cooler. The refrigerator and freezer must be monitored twice daily. The temperature should be documented on a temperature log sheet. The refrigerator should be kept between 2 to 8 Celsius. And the freezer should be kept between -50 to -15 degrees Celsius. And they should be checked at least twice daily. For air sampling, this needs to be performed every 6 months by someone certified. Someone certified could be a certified personnel outside or someone in the compounding pharmacy that is qualified. So for surface sampling, polysorbate 80 and lectin are added to neutralize the effect of any disinfecting agents. So if you use any disinfectant agents before that, then that these 2 compounds will get rid of that. So the surface needs to be clean, and they'll be able to tell if the surface has been disinfected consistently or not. All tests should be done at the end of the day, because typically that's when the most bacteria or contaminants would be present. Surface samples are taken and incubated for 3 days, and the results must indicate 0 CFUs. Action must be taken if the sample comes back with more than 3 in the ISO 5 or more than 5 in the ISO 7 areas. For cleaning and protection, the PEC should be cleaned throughout the day. Should be cleaned with a germicidal detergent, disinfectant using 70% alcohol. ISO 5 PEC cleaned every 30 minutes while working. The PEC must be left on for 30 minutes if there is an power outage, and it should be cleaned from top to bottom and back to front, which will get rid of all of the contaminants if there are any. For hazardous drug compounding cleaning, we want to use bleach or peroxide for any decontamination. We want to use a germicidal detergent for cleaning, and everything we're going to use is sterile. For respiratory protection, first we're going to have a fit test, because there are different sizes for respiratory masks, and the options do include a powered air purifying respirator or an N95 respiratory mask. When administering any hazardous drugs, you would need 2 pairs of chemotherapy gloves and a chemotherapy gown for IV drugs, 1 chemotherapy glove for intact tablets or capsules. For closed system drug transfer devices, you must be used by nurses for any drug administration. If you would like to discard any of this, you would need to discard it in a yellow bin. And if you are exposed to any of these hazardous drugs, immediately remove any exposed clothing or item. Clean any affected area with soap and water. If you are exposed in the eye, then clean the affected area of the eye using a eye wash fountain for at least 15 minutes or longer. And it is required for you to document any exposure. And after that, if needed, you could seek more medical attention. Personal protective equipment, PPE, that's going to be used for sterile hazardous drugs. You're going to have a head cover, a beard cover, if needed, 2 pairs of shoe covers, a gown that cannot be permeable, 2 pairs of ASTM, which are chemotherapy rate gloves, and your PPE for non-sterile hazardous drugs. You would need to be double gloved, a gown, a mask, and you are required to dispose of any pads or surfaces that you came into contact with. The disposal for hazardous medications, chemotherapy gown and outer shoe covers must be taken off before exiting the negative pressured air. They should be thrown away in the yellow chemotherapy waste bin. Anti-neoplastic waste, such as empty vials, empty IV bags, syringes, vials, should be thrown away in the same yellow container. But for bulk anti-neoplastic waste, they could be thrown away in black containers.